Hi everyone, my name is Lydia and I'm going to be presenting on arthritis today. The reason I chose arthritis as my topic for this project was because it's pretty near and dear to my heart. I know many people affected by the disease, including family members. It's also my sorority, AOPI's International Philanthropy, and we raise money through events throughout the year to support arthritis research. So hope you enjoy the presentation and we'll go ahead and get right into it. Hi everyone, my name The topics that we're going to discuss throughout this presentation are first is what is arthritis, some facts about arthritis, a video about phases of arthritis, different types, and we'll go into an activity, and we'll do diagnosing arthritis, preventing arthritis, treating arthritis, some impairments you could have with it, physical activity, and special considerations, our second activity, and then exercises with arthritis. So you may be asking yourself, what exactly is arthritis if you haven't really heard of it? Well, arthritis isn't just a single disease, it's an informal way of referring to joint pain or a joint disease in general. There are more than 100 different types of arthritis and related conditions, and it is the leading cause of disability in America. More than 50 million adults and 300,000 children have some type of arthritis, so that's a big number to think about. Okay, so we'll talk about some facts about arthritis. 49% of adults with heart disease also have arthritis. 47% of adults with diabetes have arthritis. 31% of adults who are obese have arthritis. Osteoarthritis is the most common form of arthritis, which affects an estimated 31 million Americans. Arthritis and other non-traumatic joint disorders are among the 5 most expensive conditions among adults 18 and older. All right, there are several different types of arthritis, so we'll go through a few of them. There's degenerative arthritis, which can include osteoarthritis, which is where the cartilage will wear away and the bone's going to start rubbing against the other bone, which will cause pain, swelling, and stiffness. Then we have inflammatory arthritis, which is when the immune system goes awry, mistakenly attacking joints with uncontrolled inflammation. Infectious arthritis is where a bacterium, virus, or fungus that can enter the joint and trigger inflammation. Metabolic arthritis is when uric acid builds up in the body and causes needle-like crystals to form in the joint, causing extreme joint pain. For the first activity we're going to do, it's just going to be a question and answer kind of deal. There will be 4 questions that you'll have to answer and post in the discussion on Pilot. The first one is pretty simple. Do you know anyone with arthritis? Can be a yes or no question. If you want to kind of explain what kind of arthritis they have, if you know anyone, if you know what kind they have, that would be kind of cool. Question number 2 is true and false. Arthritis is the leading cause of disability. Question 3 is, can children get arthritis? And question 4 is also true and false. There's only one type of arthritis. And again, just post them in Pilot. It can be listed. It's totally fine. So diagnosing arthritis is a pretty important thing to do. Medical and family history is extremely important when diagnosing arthritis because it can become a genetic disease as well. Physical exams, extremely important again, just because most of the time arthritis does have physical consequences. Another thing is imaging tests such as blood tests, x-rays, ultrasounds, and MRIs are important when diagnosing arthritis. And then on the left side, you can kind of see what arthritis is going to look like in someone's hands when they're looking at them doing a physical exam or even an x-ray. Arthritis prevention. There is no sure way to prevent arthritis. Doctors and scientists believe there are ways to reduce your risk of arthritis depending on certain activities you do throughout your life. Proper equipment, adequate training, and safe play in sports can prevent injury, which can possibly reduce your risk of arthritis. Range of motion exercises can help keep those joints mobile and cause less pressure on the joints, which could possibly reduce your risk of arthritis. Arthritis treatment. Early treatment is best. The earlier the better. Arthritis medications such as corticosteroids, analgesics, and disease-modifying anti-rheumatic drugs, infusions and injections, physical therapy, and joint surgery. On the right-hand side, you can see a boy getting an infusion or an injection at the hospital. Impairments with arthritis. It has been proven by several studies that there are cognitive impairments associated with rheumatoid arthritis. Movement of the joints and in general is difficult when dealing with arthritis. Joint pain and stiffness are both contributors to pain caused by moving and completing day-to-day tasks. Stress, sleep disturbance, and depression are all issues that can cause more pain and inflammation in joints of people who suffer from rheumatoid arthritis. Physical activity and arthritis. Physical activity and exercise can ease the pain of arthritis, improve sleep, and better functioning of daily living activities. Range of motion exercises can relieve stiffness and increase flexibility of joints. Strengthening exercises can help support and protect the joints by building strong muscles. Aerobic exercise can help with overall fitness. Walking, bicycling, and swimming are all great ways to improve range of motion without putting too much pressure on your joints. A few more physical activity and arthritis related points are daily activities such as mowing the lawn, raking the leaves, or walking your dog are all movement activities that can help with pain and pressure of arthritis. Yoga or Tai Chi are activities that can assist in balance and coordination, posture, and prevent falls. A couple special considerations with arthritis include the following. With arthritis and exercise, make sure to move at a slow and gentle pace. Take a break and stop if you feel pain. Begin with low impact exercise and ease into progressive weights and movements. Apply ice or heat to the joints after exercise to relax muscles and joints or to reduce the swelling. Do not overdo any sort of physical activity. Always consult with a doctor before trying any sort of extensive exercise. Adaptive equipment can be helpful with somebody with arthritis. Gripping equipment, which can include fat rubber grips that slip over everything from a toothbrush to a pen or a potato peeler. There are doorknob adapters, which are level handles that can fit over standard doorknobs and only need a push up or down to open the door. There are also lamp adapters, which can convert any metal lamp into a touch lamp with 3 different brightnesses. This is just a little adapter that will screw onto the light bulb. In the upper left-hand corner, that's a doorknob adapter. You can see how it screws right on top of a regular circular doorknob. There are also straps like shown that can be attached at the end of the handle. This can help with someone who has a really hard time gripping with their hands and fingers. They would just pull down, slide their hand through the strap and pull down with their wrist or up to open the door. In the upper right hand corner, the picture shows rubber grippers that are attached to some silverware. These can be attached to many things like the toothbrush shown right below in the lower right hand corner. These would help with really gripping onto the things so the surface is a little bit more rough. And now in the lower left hand corner we have the hairbrush. This has an adaptive clip or a strap attached to assist someone who has a hard time gripping a hairbrush to brush their hair in the mornings. Alright, for our second activity, I'm going to have you guys find 3 facts about rheumatoid arthritis that you didn't already know, and just post them into discussion in list form. On this slide lists all my resources that I used throughout my presentation on arthritis today. I hope you guys learned something new and enjoyed the presentation. Thank you so much.